And I remember getting a phone call, and especially from you, Dr. Minter, March 4th of 2020, that is 24 months ago. We had our first case of COVID, documented COVID-19 case in Fort Bend County, which happened to be the first documented case in state of Texas. And it was an eye-opener. We all knew that it is happening all over the world. We heard it is happening in Wuhan. We heard it is happening in some other places. And we heard that in places like Seattle and New York. But it came into our backyard, and that was March 4th. And today, March 4th of 2022, 24 months later, we are standing. And especially, I tell you, I was pretty new after a year in office. And more importantly, we've just hired our HHS director, February 1st of 2020. Dr. Minter came on board, and I think God knew that she could manage it. So give a lot of challenges to your way, Dr. Minter, and we came a long way with that journey, and it was absolutely amazing, challenging, and frustrating at times, and we took and ran with this issue without even knowing what it is. And we came a long way. And when we had testing started, we said we are going to rely on science, data, and experts. And we always did that. And we are only going to know the depth of this issue is testing the most people. And that's the reason why we did that. And we came right away, per capita basis, on the top in state of Texas out of 254 counties. And also, when it comes to larger counties, Fort Bend County is the 10th largest county with more than 960,000 people and beyond. And as county judge, and when activated, I'm the director of emergency management, and it was a true test for my capability, but with a team effort. And today I'm joined by our HHS director, Dr. Jacqueline Minter, and also our OEM manager, Mark Flathouse. These two individuals helped us, helped me, helped Fort Bend County immensely to, because of their hard work and their team's hard work. That's the reason why we are where we are today. And of course, then the vaccine came in the end of 2020, and we took the vaccine also and ran with it. And so we opened up major vaccine location, mega vaccine locations, and smaller locations over the weekend. And we went and bought even a mobile lab, a vaccine lab on wheel. And so with that all, we took this vaccine process to all across the county, and today we are standing really on the top top also when it comes to vaccine administration in state of Texas. So this has all happened because of a lot of people's hard work. And I tell you, because we relied on science and data and experts and all, we saved so many lives in Fort Bend County. And I will tell you this. In this process, we took vaccine to people who didn't have mobility. Our EMS department, Emergency Management Services Department, our health department, Commissioner's Court, hospitals and medical facilities, we all came together to work together with the one goal in mind: saving as many lives as possible. And we came a long way in this process, and I'm so thankful where we stand. And so along with that, I will tell you, Fort Bend County, not only managing COVID, we did good, and we enacted a number of programs to support our citizens. When I signed the second week of March of 2020, when I signed stay-at-home order, there were so many people overnight went jobless. and they were struggling. So that's what eventually we started a rental assistance program, utility assistance program, mortgage assistance program, daycare voucher program. Of course, small businesses are the ones struggled the most. We started a small business grant program, small business mentorship program. Another program we started, We All Eat Texas. So we paid the restaurant to cook and give it to people who didn't have money to buy food. That was a program well received and got national attention. And now we are also doing Get Hired program, paying our employees a bonus which they can turn around and give it to a new employee coming and joining them to work with them, so that we wanted to entice new employees to come and work. So we wanted to create more opportunity for everybody. Along with that, I tell you, these all programs helped us to stand today in Fort Bend County. COVID is still here, it's not gone, but we managed it very, very well. And we always followed the science, and I'm repeating this third time, always followed the science, data, and experts. Today, I'm very honored to say that we are actually lowering our threat level from orange to yellow in Fort Bend County as of now. And then we will be watching it very closely. But anytime I lower the threat level, I always tell, we are not done with COVID. We still continue to follow the CDC guidelines. And also, if you're not vaccinated, please go get vaccinated. That is the best defense we have to fight against COVID pandemic. And so why we are informing you about this threat level, because I promised you all, we are going to be transparent with what is going on in Fort Bend County. This is part of transparency. When it is going up, we are going to say it is going up. When it is coming down, we are going to tell you it is coming down. And it is helping. We are not done again. Again, I will tell you we are not done, but we are in a much better shape. And I'm so happy where we are today. And I know that it's a lot of work we put together to accomplish this goal. And at this point, I wanted to introduce our Health and Human Services Director, Dr. Minter, who played a pivotal role in managing COVID in Fort Bend County and helping even other partners in this area. And this was not a 8-to-5 job. It is 16 hours, 20 hours, sometimes even 24 hours. Dr. Minter, I really appreciate your hard work, and because of your hard work and your team's hard work, we are here today. And I will ask you to give a brief overview on where we stand with maybe more specifics.
Thank you, Judge George, and good afternoon. As Judge said, today, March 4th, marks exactly 2 years since SARS-CoV-2 made its official appearance in Fort Bend County. And since that time, our county has experienced over 150,000 laboratory-confirmed cases of SARS-CoV-2 infection. At its highest peak, during the Delta surge in August of 2021, Fort Bend County hospitals were simultaneously treating over 4,000 persons for COVID-19. And over the course of this 2 years, almost 1,200 of our friends, neighbors, and loved ones have passed away due to complications from this infection. The Fort Bend County community has stepped up to respond to the incredible health, economic, and social challenges that have resulted that this pandemic has presented. And these partnerships and collaborations have resulted in the establishment of multiple testing and vaccination locations, as Judge has said, throughout our county, when commercial locations were not available. Over 1 million COVID tests were performed throughout our county, and 1.2 million vaccinations have been provided for residents in need. And this has resulted in over 500,000 residents over the age of 5 being vaccinated and protecting themselves and the most vulnerable citizens from the worst effects of this infection. As a region, as a state, and as a country, we are all exhausted after 2 years. But we are also proud of the community spirit, the concern and the resilience of so many Fort Bend County residents, which they have shown in the face of a very unknown illness. With cases, hospitalizations, and deaths decreasing dramatically over the past several weeks, with widespread ability to receive vaccinations, and with more medications to treat COVID in the highest risk persons, it's clear that we are emerging from the worst effects of SARS-CoV-2, which will remain in our midst. For those at highest risk, being cautious about large crowds and continuing to wear masks may provide the extra protection needed, as certain people will succumb to this infection just as they do to the flu every year. COVID has proven that predictions are unwise, and we can't be certain about what the future holds in terms of new variants and their effects. But the past 2 years have given us experience and many new tools to make wise choices with which to address any challenges that may come. Thank you.